Hey guys, Ty and Sky here from Ty and Sky's Health Pub, and we are looking for the health topics that matter to you. Follow the link to submit your ideas and we'll get them covered as soon as possible.
Have a good one. Hello, Ty here. We had our first live event just the other night. It was a wonderful event that was put on at the University of Jamestown by the nursing club there, student nursing club there. And it involved Dr. Bailey Runkles, who is a new obstetrician gynecologist or women's health doctor in Jamestown, North Dakota, from the Jamestown Regional Medical Center, who came to discuss health issues, mainly periods, what's normal, what's abnormal, birth control, and cervical screening exams with a group of teenagers and college-age women. It was a wonderful event. We were so happy to be invited to help kind of take part and ask some questions of Dr. Runkles about this topic.
Cool. So we are Ty and Sky's Health Pub, and you're probably wondering, so why are like two guys like showing up in front of like a room full of women for stuff on women's health? So we're not just two guys with a podcast. That's kind of would be kind of odd to just show up and be like, all right, guys, so we just want to talk to y'all, all the girls, right? No, it's not about that. We are actually a health podcast. So we initially met in grad school, actually. So just to keep things short, because you guys are like, who cares about these people, right? So we actually met in a public health program. And so kind of part of public health is kind of this stuff right here, which is getting out this information to people. So community engagement is a very important part of public health. So we kind of met up, and we met in our MPH program, so Master of Public Health program at the University of North Dakota. And so then we both were like, hey, we both like YouTube, and we both like talking to people about health issues. Let's start a podcast. And so we did, and a couple months later, we're here today. So we're very excited to be here with you guys today. We think that women's health is a very important topic, and we want to give it the justice it truly deserves. Because it's not only important that you understand women's health, but it's also important that we understand understand women's health as well. So, your boyfriend, your father, like any sort of man in your life, it doesn't matter if it's man, woman, whatever. It's whoever they should know about this stuff. Because how often have you been and said, oh, it'd be really great if this person could go buy me a tampon or something like that. And how many of you have been like, oh, no, I'm not going to do that? Or say your boyfriend won't buy condoms or something. It's like, oh, I hate going to the store and I hate like buying them. It's like, do we have to, babe? Can we use another method? It's nothing like that. So, we just think it's really important that everyone is educated and that they can make better decisions for us as a community as a whole.
Correct. And we have mined the depths of Yahoo Answers for some of our questions here, and then we have the questions that were supplied by you guys as well, anonymously. So what we're going to be doing is we're just going to kind of mix it up, and we will have a discussion here with Dr. Runkles to answer your guys' questions and some of the internet's questions about these topics.
And you won't know which one's which. I mean, you might, but maybe someone asked one of the Yahoo questions. I don't know.
Yeah.
People have phones, so we'll figure it out. But what I'll do is I'm just going to mix this up. And if you just grab one of these.
Do I read it?
Yeah. Do you want to read it or do you want me to read it?
You have a nice voice. Go ahead.
Oh. I guess so. Or do you have a nice voice?
It's all you. Your voice is...
Okay, here we go. So what's the average cost of Nexplanon or is it IUD? Yeah, or IUD. Sorry, I couldn't read the handwriting.
That's actually a really good question and something Megan and I have been struggling with recently. So I moved here from Tulsa, Oklahoma, which had the second highest teen pregnancy rate in the country. So they actually had some really good programs to pay for IUDs and things like that. I've come to North Dakota, which has gotten, I guess you guys used to have problems with teen pregnancies, but now it's gotten a lot better. And so the cost is still pretty high here. So they run on average from $400 to $700 $100 if your insurance doesn't cover them. Now, I will give a shout out to Central Valley Health because if you can't afford to get that through me, which I totally understand, I've been in your shoes, Central Valley will place those, and they do it based on your income and like stuff like that. They do it on a scale, so it's cheaper through them.
Do oral contraceptives, so the pill, ever become harmful to a woman's body?
So there's been a lot of research in regards to that, and what we've come up with is if you are on birth control pills or any combined oral or any combined contraceptive, meaning the pill, the patch, or the ring, they prevent ovarian cancer, they prevent ovarian cancer if you've used them for 5 years, and they don't have to be consecutive. Now, as far as breast cancer, it hasn't been shown that they increase or decrease. However, there's some thought that if you have like the predisposition for breast cancer, it could act on that because breast cancers respond to estrogen, progesterone. So if you're taking more estrogen, progesterone, but there hasn't really been any shown during your reproductive age that it's been harmful. It does increase the risk of HPV because a lot of women stop using condoms after they go on birth control.
I'm going to grab more of these because I think like there's a lot of questions here. So like we want to get as many of these as possible because people want answers, right? You guys want answers. So, okay, why does running a lot affect periods, and why do we get UTIs, I guess, while running?
So UTIs, one, it's because of your age group. This age group is going to be the age group that is wearing tight-fitting clothing, sweating, not having as much chance to shower, not having as much chance to pee because you're running to your classes. And then also, this is a lot of times when you'll start having sex. And so sex increases your risk for UTI. Eventually, it gets all sorted out, but when you first start having sex. Running decreases your fat, obviously, and so our fat cells convert testosterone into estrogen, and estrogen acts on the uterus to thicken the lining of your uterus, and that's what you bleed out when you have your period. Well, if you don't have any fat, the body kind of goes into this primal self-saving mode, and so it thinks you're starving, and so the hormones in your brain stop telling your ovaries to have your cycles. One, because it doesn't want to lose that blood that you're storing, and two, it doesn't want you to get pregnant. So that's why.
Man, that's really cool. I didn't even know that at all. Like I had no idea. Like now I'm gonna like start telling people. I'm gonna be like, hey, you know, like if you're running, like that's normal. It's okay. Like don't freak out.
Well,
right?
it's not. It is normal, but it's not okay because our estrogen's responsible for maintaining our bone health. Okay, so men, they have testosterone, their bones are fine. We're the ones that get osteoporosis. So if it goes for a prolonged amount of time, you're going to decrease your bone health. And actually, your bone mass peaks at the age of 25. So you can do irreparable damage if you go for a long period of time without a period.
All right, we're gonna have you grab another one from in here, and we're gonna actually mix this up like pretty good here.
HPV shot, positives and negatives. Well, negatives, it hurts bad. I'm not gonna lie, and it gets worse. Like the third one's the worst one. Positives is it prevents 4 strains. They've got one that only prevents 2 strains, which nobody uses because why would you use it if you can prevent more strains? Then there's one that has 4 strains, and that's really good too. And then they have one that has 9 strains. So the more strains we discover of bad HPV, the more strains are getting covered. But it prevents the most common causes of cervical cancer, which is 16 and 18. And then it also prevents 6 and 11, and those are the cause of genital warts. So if you don't want to get genital warts, that's always a good idea to get your HPV shot.
On the implant, are more frequent periods common?
It's okay, so if you're talking about the one in your arm, so there's the implant in your uterus, and then there's the implant in your arm. The implant in your uterus will not change. Initially, your body will have to get used to it, so the first couple months, you'll probably have like a heavy period and then light spotting for a little while. But then after that, your period should get lighter and lighter, and it won't change the timing. After you get to the point, not all of you will, but after you get to the point where you don't have a period at all, you need to remember you're still ovulating, okay? So what that means, if you're crazy and you're running around looking for chocolate and commercials make you cry once a month, you're still going to do that. You just won't be bleeding, and you'll be like, why am I insane? Oh, wait, I'm on my period, and I just didn't know. So that's for the IUD, okay? And I do speak from personal experience with that one. My husband's like, what is wrong with you? I'm like, The Nexplanon is different. It will totally change your cycles. And there's no way to know how that'll go. A lot of times in heavier girls, it will make their periods lighter. And in lighter girls, it will make their periods just more erratic. But it takes an average of 3 months for any birth control to do its damage as far as changing your period. So if you get it and you hate it, give it 3 months. And then if you still hate it, we can take it out.
I guess a follow-up question to that. During that 3-month period, is the birth control effectively preventing birth?
Oh,
or
yeah.
do you have to wait for that?
No, it's effective. From now, the Nexplanon and the Mirena, you're supposed to practice like a backup method for 2 weeks, just in case you could have been like ovulating before you got it.
Oh, this one has multiple questions on it. Okay, so well, that's this one. Okay, I think I may be pregnant. Where can I get a professional test done?
So you can get a professional test done in any of our office. Now, I will tell you, even the Walmart 88-cent one is accurate up to like 20 units, which is the same as what we have in the hospital. So if you have $1, you can get your test from Walmart and be slick about it. But if you really want to see a health professional, any of the local doctors or I think Central Valley Health does that too.
And just a follow-up to that. So if say I am pregnant, but I don't know what to do about it, where do I go? Like, for example, if I don't want to know any parents or any family or any of my friends to know that I'm pregnant, what should I do?
That I am not actually sure, but I would start with Central Valley Health. I think they would probably have the resources as far as that goes. Or Essentia or Sanford. Okay, they're all confidential. Am I not confidential? I'm confidential too.
And I guess
I was like, what?
that may be a good thing to drive home specifically. If somebody comes in and has a positive pregnancy test and are under the age of 18, maybe we'll say, is that something where you have to report it as a doctor to their parents, or how does that work?
The minute the stick turns blue, you're an adult by law. So don't you worry about it. So what if my vagina smells weird? We laugh, but all of us have been there, okay? So especially if you're active and it's summer and you're outside and you're wearing tight-fitting yoga pants, it's gonna get a little hot in there, right? So normally an abnormal smell is either, one, you need to take a shower, which go do that. Or two, it's because of an imbalance in, the bacteria in your vagina. Now, whether or not it's an STD can only be checked by getting an STD test. So I would say if it was me, I'd get an STD test if I was concerned about that. If you're not concerned about that, then it could be either a yeast infection or what's called BV, bacterial vaginosis. And what that is just an abnormal overgrowth of the bad bacteria in the vagina. It's not an STD, they're just there, and they sometimes take over, and they smell kind of fishy. And so we treat it with an antibiotic.
So, after breastfeeding, do your nipples return to their pre-pregnancy state?
I have not been there, but I would wager no. So your body is never going to be the same after you have a kid. It's just not. And that's part of us being warriors. We procreate. We are here to make man survive so they can go have their podcasts. But that being said...
The pressure is on.
That being said, even if you don't breastfeed, your breasts are not going to return to the way they were. Your breasts actually don't reach maturity until your first baby is born. And then then they become mostly fat instead of the dense tissue.
And kind of on the other side of that coin, something else that comes up, so with birth control, there's always this concern of potential weight gain. Are there specific birth controls that always cause that? Like that's going to happen, or? So
the biggest one that studies have shown is Depo. And I get a lot of girls that come in and they're like, well, I didn't have any weight until I gained on Depo. And the statistics say up to 5 pounds in a year, which doesn't seem like a lot, but I mean, that's a little bit. And then, pills, not so much. A lot of times they'll make your breasts fuller, which, hey, why not? But there are some that can kind of make you bloated, and so we can talk about ones that don't do that, because no one wants to walk around bloated. So.
What are some causes for painful sex?
There are quite a few. I would say the most common is endometriosis. About 1/3 of painful sex comes from that. And what that is the lining of the uterus. It should come out when you have your period, right? Well, sometimes it flows backwards and it comes out of your tubes and it implants on your ovaries and in your pelvis. Well, those cells still act like they're in the uterus, so they respond to your hormones, and so they try to have a period every month, and so you can have bleeding in your ovaries and in your pelvis, and that can be a major cause of pain when you have sex. Other causes can be STDs, obviously, so definitely get checked out for that, and then, there's quite a few causes, so it would definitely be something we would have to talk about to figure out what would be causing your pain. Do you have to take the mini pill, that means progesterone only, at the exact same time every day? Yes. The mini pill is probably one of the least effective methods, but we use it a lot in women that can't have estrogen because of migraines and blood clots and things like that, or if they're breastfeeding. But the downfall is you have to take it at the exact same time every day, or it's not as effective.
So is that like 3:03 on the dot, like every day, or is there like some
Within an
leeway in
hour.
that? Okay, because that would be pretty bad. You're like, oh, I took a nap, and then
Yeah.
oh no.
I usually set an alarm for things like that.
Yeah. I would set like 5 alarms for something like that. Like one at 3 o'clock, one at 3:01, 3:02. Yeah, that's just me though, I guess.
You don't want to get pregnant?
I don't. It sounds like it would be pretty difficult to deal with.
Yeah.
So.
It looks tough, I'm not going to lie.
Do you have a personal favorite or a birth control that you recommend the most or find yourself recommending the most, and a birth control you find yourself recommending the least?
So I want to make something abundantly clear to you all. The birth control pill was developed by a man, God bless him. But he wanted the Pope to say, yes, you can take it. And so he made a pill that you would still have a period on every month. There is no reason on this earth that you need to have a period every month if you are on birth control. So, just putting that out there. That being said, I really do like the Mirena because it's, one, it makes your periods lighter. Two, it's super duper effective. You can take it out and get pregnant whenever you want. In theory, if everything else works. So I would say that's probably my personal favorite, and I have had it. However, for someone that's really anal about, no, I have to have a period, it's not the choice for you because you may end up not having a period on it for like a year.
All right. And then the follow-up question for that is, what is the menstrual cup, and would you recommend using it?
So I'm not going to recommend a for or against because there hasn't really been enough studies, and that's kind of common in our field anyways. But menstrual cup is similar to the NuvaRing's shape, except for that it's a cup, and it goes in the same place. So it sits at the top of the vagina over the cervix, and then it just kind of prevents the blood from coming out, and you collect it, and then you take it out, empty it, wash it, and put it back in. I've never used one, but it's kind of the new thing. It's very, what do you call that? Recycle, reuse, environmentally friendly. So people like it because it's, tampons, they are not always biodegradable. So I think that's kind of one of the reasons people are using it. But I have talked to a lot of people that really do like it. So
is it abnormal to have spotting for 3 to 4 days after your 4-day period?
yes.
That was quick. That's just yes.
No, I mean, it depends on what you mean by spotting. Is it part of your period? Is there like a time in between where you're like, so you have a period for 4 days, then nothing, then spotting again? Yes, that's abnormal. If it's like 4 days heavy, but then it kind of trickles down and it's like old blood, that's probably just the end of your period.
And just to ask, I guess, a quick follow-up question regarding contraceptives, because I was always curious about this too, and I have to get one question in, right? Just one. So I was curious about the use of female condoms versus male condoms, because I've heard about female condoms, but I don't know how many people are carrying around a female condom anymore.
So I've actually never dealt with them. You mean a diaphragm, right?
Yeah.
Okay.
Well, yeah, that's the real name for it, yes.
So a diaphragm is similar to actually that cup you were talking about. I think that you would go in and you would get it fitted to your cervix, and then you would have to, one, make sure it's clean, obviously, and then you would have to put spermicide on and then insert it and then, do all your fun stuff. And it's just that just seems like a lot of prep work,
And that would be each time that you would have sex.
Each time, yeah.
That's a lot of steps.
It is.
Yeah.
It's a lot of steps. It's like, don't dim the lights just yet. But also, you know, a lot of women found that they were allergic to the spermicide, you know, which I think would be pretty common. I don't know. And I don't even know where you would go to get fitted one. Don't come to me because I have no idea.
Just old, outdated methods, I guess.
Yeah, I mean, we have better ones now. What's your number one birth control for an 18-year-old? Again, I would suggest the Mirena. I really like it, but for someone who's not had kids, now mind you, I've had 3 because I've been busy becoming a doctor, but I don't have any kids. And, you know, a lot of people will tell you can't have one if you haven't had kids because it's going to hurt too bad. I'm not going to lie, it hurts. But for my younger girls, I give you a medication to take before we insert it, so that your cervix will dilate, and I try to have you come in on your period for 2 reasons. 1, because your cervix will be more open, and 2, we know you're not pregnant, so we don't have to do a pregnancy test, and it's effective right away.
So this is talking specifically about the pill. If I miss a dose on one day, so say the 5 alarms that you said, Skylar, didn't work for you on that particular day, you slept through them, and you missed a dose, how long until, or how many, I guess, consecutive days of taking the pill until it's effective in preventing pregnancy again?
So if it's just the mini pill and you miss a dose, I would use backup methods if you really, really don't want to have a kid. If you're kind of like, you know, I guess you could gamble. But if it's like a combo birth control pill, which most of them are, if you miss a day, just take it with your pill the next day. If you miss 2 days, same thing. If you miss 3 days, you need to use birth control or condoms until you have your next period. And then you need to come see me because you shouldn't be missing 3 days, and we'll choose something else.
So there seems to be this whole part about fitting it into somebody's lifestyle as well.
Yes.
Like matching the birth control method to the lifestyle.
Yeah, definitely.
Do you find that convenience is more expensive? Because I know that for a lot of like kids our age, that, you know, the financial reason is one of the biggest barriers to contraceptive use, or even, you know, things using like Plan B, for example, because Plan B is like very expensive. So like, what do you recommend for, I guess, people that are going through that kind of experience where they're like, oh no, you know, like, or I might not have the money for, say, Plan B or something like that. What is the next best thing that I can do?
Well, 1, I want you to consider the fact that you usually pay for a child for roughly 18 years. And these days, they come back after college. So, how expensive are they really? Yeah, the cost, I mean, it's just one of those things you got to weigh, you know, and then even the stuff that we can prescribe, it depends, like, again, on that insurance plan. I'm not sure how much you'll be billed with, so it's risks and benefits, my friend.
You mentioned going 90 plus days without a period could lead to cancer. How can birth control safely prevent periods then?
Okay, so the reason that going that long without a period can cause cancer is because, again, coming back to our fat cells convert testosterone into estrogen, right? And we talked about that. Estrogen stimulates the lining of the uterus to grow. If you're saying grow, 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 and you never say stop, then that's how you get cancer. With pills, we've got the progesterone, which says stop growing. So that's the difference. So if it's just your body doing it, it's just estrogen saying grow, grow, grow. And sometimes it's not. Sometimes it's like if you have PCOS, you have a lot more male hormones than the average female. And so in that case, you know, the lining may be really thin, and that's why you're not having a period. But it's really, we just need to make sure. And usually it takes a long time to get to cancer, but I'm going to be honest, I've already diagnosed a couple cases of endometrial cancer here, and I've only been working here for a month, so just putting that out there. Can you get an IUD if you haven't had kids? Yes, you can. Will it hurt a little more? Probably. We'll pre-treat you, and then you can, you know, take the day off.
And with the Mirena, do you know specifically, like, what day each month you're going to get your period? Like, does it kind of help you schedule things out or not?
So initially the spotting will be really irregular, but then it'll go back to your normal period. So it's whatever, if you're someone that has a period every 30 days, you would get it every 30 days. And if it gets later and later and later, then, so I would suggest keeping a panty liner at least, because usually it's not heavy enough that you're going to like need a pad. But I would at least keep a panty liner in my purse just because sometimes it'll surprise you.
Okay, how common is it to have severe pain when getting an IUD? I guess like for initially getting it.
It's pretty common. It hurts. I'm not gonna lie, it hurts.
Is there like a scale for it? Like if you had to compare it to like other types of pain?
I haven't had labor yet, so I don't really know.
Okay.
But it took everything inside of me not to kick the woman putting it in. So, again, I will pre-treat you, and a lot of times, if you want, we can give you some pain meds for the procedure. You just have to have someone to drive you because you can't be driving home on narcotics. And some women find that it doesn't hurt at all, but I think they must be crazy.
Very high pain tolerance, I guess.
Yeah, I guess.
So this question, how do I prevent rashes on my vagina?
That's a really good question. So it depends on the kind of rashes. If you're finding that they're like kind of like scaling and bright red and just really itchy, it could be one of two things. It could be like yeast infections, which most commonly occur because of being really wet environments. So that being said, you would want to make sure you're using cotton underwear, none of that synthetic stuff, because that doesn't breathe as well. And then your yoga pants, try to get ones that wick. A lot of the wicking ones will keep the moisture out of your crotch. If it's not yeast, then it's probably a reaction to what you're wearing, whether it be the materials or your laundry detergent. You know, a lot of people don't realize how sensitive they are until, you know, like my sister, she was like rolling around and like scratching herself to death in these sheets. And I was like, stop it. Turns out she's allergic to the dryer sheets. So that happens with your clothes too, and you just don't really think about it. So if you skip your period with birth control, is it normal to bleed in between for more than a week? So that is one of the things about skipping your period. A lot of times you can get breakthrough bleeding. The best thing you can do is try to be really consistent with your pills. And then if you do have breakthrough bleeding, sometimes it's best to just do it. Just have your period and start over. But if you're consistently having breakthrough bleeding, either we need to adjust the type of pill you're on, because some of those ultra low dose ones don't have enough estrogen, and then your lining gets so thin. It's kind of like if you have a scratch, it just bleeds from the irritation. So we can put you on a higher dose estrogen, or just give you an estrogen one-time shot to stop it and kind of get things to stabilize.
And this actually goes into, this question's about pap smears, which you covered in your earlier presentation. But question is, I've heard if you have been on birth control, you should get a pap smear earlier. Is that true?
So the thought process was like, if you're on birth control, you're having sex earlier. And it used to be like, well, we discovered that if you have HPV, that's how you get cervical cancer. So they said, let's start doing pap smears when you start having sex. The problem is we were diagnosing all these young women with HPV infections. And young women, you guys are strong, you have strong immune systems, you've got everything going for you, so your body's usually strong enough to fight off the HPV infection. And we found that these young women before the age of 21 would clear the infection within 8 months. So these women were having procedures on their cervix to try to treat this infection that ultimately their body would have taken care of anyways. Well, what are women doing in their 20s? They're having babies. So we were treating these precancers, and it was affecting their cervix. Well, when you have a baby, your cervix is responsible for holding the baby inside until it's time. And so we were making their cervix not as strong. And so a lot of women were having preterm labor. So now the recommendations is, unless you have HIV or some type of immunocompromised state, like if you're on chronic steroids, no pap smear until you're 21.
Is putting in the ring uncomfortable?
It's very much like putting in a tampon. It's kind of, it's a ring, it's about that big, and it's kind of squishy. And so you just squish it, and then you insert it similar to a tampon, and then it kind of pops up and sits on your cervix. Getting it out is a little more like fishing. You gotta. So I would say getting it out is a little more uncomfortable than putting it in. What are the negative effects and possibilities of caffeine on your body besides dependence? I'm going to be a hypocrite if I say anything, because I drink a lot of coffee. There has not been a ton of negative effects shown. The one big thing would be caffeine is dehydrating. It's a diuretic. And so if you're going to drink caffeine, you need to replace what you've lost. So let's say you have a cup of coffee. You need to drink a glass of water to replace what you've lost, or you're going to be very dehydrated. And dehydration leads to UTIs and things like that. But, I mean, there's not really a lot of negative things that have been shown. I mean, you can find a study to support anything pretty much these days. But they're saying it prevents Alzheimer's, so I'm going to go with that.
Okay, and this kind of covers something you went into a little bit earlier about fertility, but does taking birth control pills as a teen or young adult affect fertility when you want to have babies, I guess, like later down the road?
So it should, I mean, there's no evidence that it does. The only thing, so one thing you need to understand is men make their sperm every 70 days. So that's why they maintain their fertility in theory forever. We were born with all the eggs we'll ever have. The most eggs you will ever have is when you are at 20 weeks in your mom's womb. So, I mean, on the whole, you're getting less and less eggs throughout your life. So birth control doesn't affect the eggs that are there. They just prevent you from ovulating what you would have ovulated on that cycle. And not all birth control even does that. One thing that women will find, though, is when they've been on birth control as long as they have, if they hadn't been on birth control, they would have realized they actually have really irregular periods. But because they've been on birth control, they're like, oh, yeah, my periods are totally normal. Well, yeah, you've been on birth control your whole life. So they come off and they're like, man, my periods are so irregular. Well, they were probably irregular to begin with. One exception is Depo. So the Depo shot can take an average of 18 months to return to fertility. So in women that are hoping to get pregnant in the next year and they're like, oh, you know, I'm getting married and we want like about a year to spend together and then we want to try to have a baby, I say do not do Depo because you don't know how long it's going to take for your fertility to come back.
And I think we have time for one more question. So we'll give you the honors of picking the last one. I'm just going to move these around. We got through a lot of them, actually.
I thought so. Okay. If you're on the shot and you don't have your period, is that bad? So, no, that's pretty common. The Depo shot, almost everyone that goes on it stops their period. And it's because it's progesterone. It's very high-dose progesterone. And we said estrogen makes the lining grow. Progesterone makes it thin out. So it's just that constant progesterone that keeps it nice and thin, and so you don't have anything to bleed.
And we always like to end each one of our shows with kind of some non-medical questions. So we have two that we're going to fire at you. They have to do with the solar system, I guess, reasons. So, if you could visit any planet in the solar system and not die, which planet would you like to visit and why?
I think Neptune, because it's pretty.
That's a solid choice.
So if you were to pick one to be.
A planet to be?
To be.
Is it too funny if I say Uranus? Just kidding. I wouldn't be Pluto because he got downgraded.
Yeah, that's true.
It'll change in another year, and then it keeps coming back and forth.
Perfect. Well, thank you, Dr. Runkles, for joining us today on Ty and Sky's Health Pub. And thank all you guys for showing up and providing the awesome questions.
Yeah.
Thank you, guys.
Yeah, let's hear it for you. So thank you very much to the Jamestown Regional Medical Center for letting us come on and join this event. Thank you for the University of Jamestown for putting it on. And thank you to Dr. Bailey Runkles. You're a rock star. You did a great job. It was a fun time.
Yeah, and thanks for everyone that showed up too. It was a really great turnout. We had about 90 people in attendance. Probably in terms of everyone that stayed, when you have to talk about college events, pizza and water gets people in the door. But people stayed. People were so engrossed in the topic. It was so exciting to see people so enthusiastic about hearing about issues that directly affect them and really wanting to know the answers to those questions, especially with regards to women's health and some of the stigma of not being able to get correct answers. So it was definitely a very relaxed environment for people, and they were able to get true answers, and it was just really great to be a part of that for sure.
So thank you guys, and we hope to catch you guys at a live event in a town near you sometime in the future.
And have a good one.
Hello, Ty and Sky from Ty and Sky's Health Pub here. Are you an event organizer looking for a way to take your event to the next level? Well, we also do live podcast events with real health experts about the health topics that matter to your community. If you're interested in having us come out, follow the link and let us know.
Have a good one.